Brendan Bunzel. I'm a student PT at South College. And before we get started, is it okay if we record our interaction today?
Yes.
Awesome. And so, Ms. Bunzel, today I would like to do a couple of tests and possibly try out an exercise which might involve me palpating some bony landmarks and some muscles on your lower leg. Is that okay with you?
Yes.
Awesome. So first, I would like to test the valgus stress test. The point of this is to determine the integrity of your MCL. So what I'm going to have you do is scooch towards me on the table, please. Okay. And for the first part, we'll have it slightly flexed. Okay. And let me get in a good squat position. We want that hip to stay neutral. Okay. You tell me if you feel any pain, all right?
Oh.
Nope? Okay. Now we'll do it straight-legged. You can relax your leg. Okay.
No, it's good.
Awesome. Okay. So that's going to be a negative on that. Next, what I would like to test is a grade 4 mobilization, grade 4 mobilization, inferior glide of your patella. Okay? And the point of this is to hopefully increase knee flexion. So let's do it in a way that the camera can see. Let's see here. I'm sure it can. Okay. So first I'm putting my leg underneath to induce slight flexion. Now I'm going to cup underneath the patella and around with my bottom hand. Then with my top hand, I'm going to find that base of the patella. And I'm going to start off with just 1 and 2 mobilizations to see how the patient feels. If they're okay with that, then we'll jump straight into grade 4. Okay?
Okay.
All right. Okay, that's 1. That's 2.
Good.
Good?
Mm-hmm.
All right, we're going to go ahead and go to 4. Is that okay?
Yeah.
Awesome. All right. Now, what I would like to do is I would like to test the inversion and eversion Taylor tilt tests. So, let's see here, make sure I'm not forgetting anything. I'm gonna have you go ahead and scooch closer towards me. Make sure this is on camera.
Is that good?
Yeah, and if you could flex this knee so that way the camera can see.
Okay.
All right. So first, I'm going to cup below the foot and place it on my forearm to place the ankle into neutral. I'm going to stabilize with my other arm right where malleoli are, but not hindering the joint. And first I'm going to go ahead and I'm going to push from there, and that would be a eversion test. Did you feel, or I'm sorry, inversion test, did you feel any pain with that?
No.
Awesome. So for this test, what I'm looking for is the integrity of the ATFL. And next we'll do the eversion test. So same thing, just flip-flopped. Okay, back into neutral. Got my thumb in the right spot. Got my hand cupped good. Got you stabilized. Okay. That feel okay for you?
Yeah.
Awesome. Okay, so no pain there. That test is looking for something like deltoid ligament laxity, integrity, things like that. We have one more. I know we have exercise and progression. I'm trying to remember if there was a third test. Was there a third test? Oh.
That's it.
Oh, okay. Well, while we're thinking it, we are done with the test. Now we can move on to the exercise. So for this exercise, we want to target the glute medius. So what your glute medius does is, I'll stand up here a little bit, is this exactly.
Okay.
It's called abduction of the hip, or you can think of it as your abduction just means to like going away from the body.
Okay.
Yeah, one of the most important muscles ever of all time, so it's important for it to be strong.
Okay.
So what I'm gonna have you do is go ahead and roll to your, I'm gonna have you scooch to the center a little bit, and then I'm gonna have you roll towards me.
Okay.
Onto your side, yeah, and then you might need to scooch up a little bit so you have enough space for your legs.
Okay. Better?
Yeah. All right, so I want you to keep your hips stacked and in neutral, and where you'll be feeling the muscle activation is going to be right here.
Okay.
Okay, so I want you to straighten this leg out. Okay, feel free to bend this leg if that's helpful for you. Okay, and I want you to lift this leg straight up to the sky as high as you can go. Great. Okay, let's see it again. Okay, so now normally I would prescribe 3 sets of 10 of those,
Okay.
but for brevity's sake, let's go ahead and do 1 more on this set, and then we'll take a small break, and now let's do 5 more. As she's doing this, I'm looking to see if there's any compensation, and it looks like everything looks okay to me. In fact, I'd say it looks like good form. All right, and for progression, we don't have a band here, but, or actually, if we were to progress this to standing, what we could do is, you can sit up if you'd like. So to progress this to standing, we can do what's called a 4-way hip, where you go forward, that would be flexion, to the side, which would be the abduction, and then behind, which would be extension. But since we want to focus mainly on the abduction of the glute medius, we can put a band around both your ankles and on the side that we're trying to improve strength. We'll just have you go out to the side and come back. Out to the side and come back. Oh, I could have a little bit better form actually. Out to the side and back. And same thing, 3 sets of 10. If we feel you're comfortable enough with the previous exercise, we can progress to that. All right, now that we've completed this, do you have any questions for me?
No.
Awesome. Okay,